Evet, günün bu son oturumunda bir
Now, this is the last session of our day, so thank you for choosing this hall over the other. There aren't many things to say under this title because it's quite a new topic, as you very well know. We're just gaining experience as people working in this field. So I'd be more than happy to hear about your experiences and your sharings. So please take the opportunity to share with us your own experience, either during the talk or after the talk. I've been talking with Mr. Hasanovic, and Mr. Hasanovic told me that they never ran into synthetic cannabinoids in Sarajevo, in Bosnia-Herzegovina. It's brand new in Turkey as well, but it has become a serious problem in a very short while. And it's a part of general psychiatry anyway. Even those colleagues that do not necessarily deal with addiction ran into problems with synthetic cannabinoids, and they will continue to do so.
Evet, sentetik kanabinoidlerden bahsedebilmek için öncelikle kanabisten.
Okay, to talk about synthetic cannabinoids, first we have to talk about cannabis. Of course, the synthetic cannabinoid would be the synthetic form of the cannabis itself. As you very well know, this is achieved from cannabis sativa. There are many different names given to it in Turkish. And it is a substance that we're more than familiar with, that has been in use for many years. This weed is achieved from the resin of the plant, and the active substance is tetrahydrocannabinol. It becomes effective in 10 to 20 minutes and continues to do so in approximately for approximately 3 hours. It doesn't dissolve in water, therefore it cannot be taken in IV form. It causes euphoria, relaxation, and cheerfulness. It has some other physiological effects such as redness in the eyes and increase in appetite. It can also cause illusion, hallucination, or psychotic excitations or anxiety attacks in some others. It has an impact on the functioning of the hippocampal and limbic systems, and it therefore leads to some undesired effects. I'm still talking about the natural cannabis. Approximately 5% of cannabis users end up with a diagnosis of schizophrenia. The prevalence of schizophrenia in the general population is 1%. Therefore, the prevalence increases by 5-fold in cannabis users. I want to talk about some basic facts about cannabis so that I can compare it with synthetic cannabinoids later. It can lead to anxiety, panic attack, especially in case of using a substance where the active ingredient, the tetrahydrocannabinol, is higher in content, or in new users as well. Anxiety and other psychotic symptoms disappear in time without any need for medication. However, in severe cases, benzodiazepine or haloperidol can be administered. Up until recently, that is up until DSM-4, it was thought officially that there is no withdrawal of cannabis. But DSM-4 defines cannabis withdrawal as well. It depends on how long a person has been using cannabis and how frequently. So the severity and it disappears all by itself. It doesn't require a specific therapy. So all that I've told you so far are some general effects that we are all familiar with. But there are some therapeutic sides of this plant that we're not very familiar with. They work as an appetite increaser in AIDS patients, spasticity in MS, and some other medical uses. It is affected through cannabinoid receptors 1 and 2 in the brain. Endogenous cannabinoids bind to these 2 receptors through which they become effective. In the resin of cannabis, there are approximately 60 types of cannabinoids. Tetrahydrocannabinol is the most effective of all. It has the highest psychoactive effect, but of course there are some other molecules within the cannabis itself. It reduces serotonin and increases norepinephrine. However, it has some medical benefits as well. Therefore, in spite of the fact that it is not used as a drug in our country, in some other Western countries such as the United States and in some European countries, it is also launched in the market in a medication form. So there are some cannabinoid molecules that have been launched. You've just seen a list of them, and they have different indications. There are some studies, for example, showing that they're more effective on neuropathic pain than placebo. They have an impact on the Parkinson's disease as well. And there are many studies conducted on MS patients showing the benefits of these cannabinoid-containing drugs. One of the most recent drugs is an oral spray form, which is not yet available in the United States. It has 2 different cannabinoid alkaloids inside. Sativex is the name of this drug. It has a spasmolytic effect on MS patients, and it is indicated for those patients that do not respond to other therapies. Neuropathic pain, overactive bladder, and cancer are some other cases in which it is indicated. Some researchers claim that it is also indicated for Tourette's syndrome. The correlation between epilepsy and cannabinoids is a bit complicated. Some claim that it can cause epilepsy or epileptic episodes or convulsions. The relationship between cannabis and stroke is not very clear either. There's evidence in both directions. For example, in 2009, there were 15 cases of stroke reported due to cannabis use. There are some publications that say that it might be effective on AML and neurodegenerative diseases. So we have this natural substance. It has some negative impacts, but it has some therapeutic uses as well. And this leads people to produce some synthetic cannabinoids which have less harmful effects. However, so far, not much has been discovered. However, the studies show that the synthetic cannabinoids have psychoactive effects, and due to their psychoactive effects, they cannot be launched in the market. And this does not keep them away from the markets, actually. They made their way into the black market. These are designer drugs, molecules that have been produced in the labs. And they appeared as a result of studies to create analgesics, to produce analgesics. They don't have much of a history in the world either. They date back 4 or 5 years. At first, these were introduced as products that are completely natural and that do not cause any form of addiction. Some of the names that they carry abroad are Spice, K2, and Genie. They're also called bath salts. And in Turkey, Bonsai, Jamaica, and Jamaican Gold are some of the names that are given to these synthetic cannabinoids. The first sales over the internet started with a picture of the bonsai tree, claiming that it was something completely natural. That was the kind of impression they used in marketing these synthetic cannabinoids. But even the users today know that this is not a natural product. It is very common among cannabis users. If you're interested in this topic, you would know that for each substance there's a different sales channel. There are different heroin sellers and there are different cannabis vendors as well. So they've come into the market through cannabis dealers, and they look like cannabis. It can be rolled into a cigarette paper, or it's can be used as a bong through this method, which is very similar to actually the use of cannabis itself. So this is a brand new substance that the cannabis dealers now produce. Now provide to the market. So people, the users of cannabis wanted to give this a try too, which led to an increase in the consumption of these synthetic cannabinoids. It is at least 10 times more effective than cannabis, though. Irregular weed smokers, for example, become compulsive users when they switch to synthetic cannabinoids. Some people, for example, say that they used to smoke weed once or twice a month, but now they compulsively smoke synthetic cannabinoids. This is actually a substance in liquid form achieved in a lab or generated in a lab. This is sprayed onto dried plants or dried leaves. There's no standard concentration, of course, in the spraying. And it is made up of many different molecules. Therefore, you can never be sure about the dosage intake. JWH, HU, and CP are some of the abbreviations that are used for the molecules that they contain in their own chemistry. They have an impact on cannabinoid receptors as well, but their chemical composition is much different than that of cannabis. Their affinity and activity on the cannabinoid receptors are much higher than natural cannabinoids. Therefore, of course, there's a higher risk of adverse events and addiction. As of February 2011, these synthetic cannabinoids made it to the list of illegal substances after being issued in the official gazette. They have some impacts that are similar to marijuana, but different at the same time. They cause convulsion, first of all. Convulsion is very rare in marijuana smokers. Some people even claim that marijuana can have anticonvulsive effects, but convulsion is very common in synthetic cannabinoid smokers. It has a higher rate of anxiety. It increases the heart rate. And many users told me that it causes panic attack. And many users told me that it is very illogical for them to use it. They know that it's irrational, but they can't stop consuming it. It causes more aggressivity, more aggression than regular cannabis, than natural cannabis. Natural cannabis is used to reduce muscle rigidity. However, most of these patients, when they come to emergency rooms, they come with a complaint of muscle rigidity, and they cause confusion much more than natural cannabis. The onset of the impact is much faster and stronger. That's why probably it is consumed compulsively. They don't appear in routine toxicological screening tests, so they're easier to be used. People who are released on probation, for example, they have to give urine samples from time to time, and they know that these synthetic cannabinoids will not show on their screening, on their tests. And most people are on probation due to cannabis. Therefore, they can easily switch from cannabis to synthetics. There are some kits, for example, which are not routinely used, which can detect synthetic cannabinoids. They're not very commonly used, as I said before, and there are different molecules in synthetic cannabinoids, and these kits cannot detect each and every molecule. Synthetics can cause withdrawal, addiction, nausea, vomiting, tachycardia, hypertension, tremor, paleness, redness in the eyes. Not all impacts are known, and we do not know if these are all caused by the active ingredient inside, active substance inside, because some of these effects might be caused by heavy metals, because we do not necessarily know what this final product contains. The Toxin Control Center sometimes reports cases in which there's also heavy metal poisoning. There aren't many studies in the literature conducted on this issue. On PubMed, you can see different cases that are being reported, though. We have 3 ongoing studies. One of them is a study that we run with the snowball method to have a better idea about the user profile. Another study looks into the relationship or the correlation between synthetic cannabinoid use and psychosis. And the third study is about the perception of synthetic cannabinoids among youth. These are all 3 ongoing projects. They haven't been finalized yet. We have many cases. I can even say that this is the primary reason for seeing a doctor at our center. Convulsions are very common, as I said before, and these are mostly generalized tonic-clonic episodes. They do not cause any sequels. Sometimes users are brought to the emergency room unconsciously. A publication from 2011 says that if it's a young male patient and if it's the first generalized tonic-clonic episode, then the differential diagnosis should include synthetic cannabinoids. Clinical presentation can include many different symptoms: agitation, confusion. Psychotic symptoms are very common in these cases. And if this is, for example, new onset psychosis, if we know that the person is using substances but the urine screening is negative, and if the person is on probation, then we have to take into account synthetic cannabinoid use in our differential diagnosis. I would like to also refer to some other negative outcomes of synthetic cannabinoid use. Nephrotoxicity is mentioned in some recent publications from 2011. Many nephrotoxicity cases were reported in the United States, as well as many renal failure cases. Most of them were cured without any sequels. I saw a case at Chapa with acute visual impairments. I saw another case with Wernicke syndrome. It was a 23-year-old male patient. So the patient came to us with a cerebrovascular event that caused mesencephalon impairment. But these were cured without any sequels. There's no specific therapy to treat the withdrawal or addiction of it, but I'm sure it's useful to increase awareness, and I'm sure it's also useful to include it in our differential diagnosis, especially in the case of convulsions. And it has to be kept in mind for those young patients who are referred to us with manic disorders. Thank you.